purpose of this video is to help you understand if you have carpal tunnel syndrome. Carpal tunnel syndrome involves the median nerve and your wrist and your hand, and the problems that come when that median nerve gets compressed. Your symptoms will usually relate to numbness in your thumb, index, long, and this half of your ring finger. The other half of your ring finger and your little finger are usually not involved in the symptoms of carpal tunnel syndrome. Carpal tunnel syndrome often starts all the way up here with tightness in the biceps muscle. You will often find that the biceps muscle is tight and in more spasm on the painful or symptomatic side than in your other arm. You will also find, perhaps, that there's spasm and tightness in the palm side of the muscles of your forearm. Learning how to stretch your biceps and learning how to stretch your forearm in many people can help alleviate the symptoms of carpal tunnel syndrome. The nerve, as it comes through your wrist or carpal tunnel, gets squished. And when that nerve gets squished, these fingers go numb, and you may also have pain that goes from your hand up your forearm and even up as high as your shoulder. Everybody is a little bit different. The nerve, as it comes through this canal, has to move. When your fingers open and close, the tendons move, and so does the nerve that also comes all the way out to your fingertips. If this nerve is stuck here, then the nerve gets pulled on every time you open and close your hand, which is another reason to develop carpal tunnel syndrome, and that's from scar tissue between a ligament and your nerve. The most popular physical test that your doctor will send you for is called an EMG, where somebody will put needles into the muscles in your forearm and put needles into your hand, send electrical shocks down your arm, and measure how fast the nerve impulses and electrical activity go through your wrist and into your hand. It's not a very comfortable test, and there's a more reliable physical finding that you can do all by yourself. By far, the most important and reliable physical finding in people who have carpal tunnel syndrome is called a positive Phalen's test, which you can do yourself. Phalen's test is spelled P-H-A-L-E-N''S, and all you have to do is take your wrist and bend it about 90 degrees. When you bend your wrist at 90 degrees, it compresses the nerve and the tendons in your carpal canal. If that compressed nerve brings on symptoms in your thumb, index, long, or ring finger, and they go any more numb than they usually are, or even start to get numb in the 45 seconds that you have your wrist bent in this position, you most likely have carpal tunnel syndrome.